It is very common for patients like Richard to have a combination of symptoms, such as diarrhea one day and constipation the next. Dr. Gray, how common is this variability in symptoms?
The symptoms of irritable bowel syndrome are characteristically quite variable, and one of the features is that the symptoms will change from moment to moment even, and certainly from day to day. The most common symptom that individuals have is abdominal pain, and this is often an intermittent cramping discomfort, typically in the lower abdomen and often in the left lower quadrant, remembering that that's where your bowel muscles are the strongest and the thickest and the most active. The second most common feature would be an alteration in bowel habits, and often this alteration will vary from day to day or from moment to moment, and usually includes diarrhea and often quickly moves to constipation. And it's quite characteristic to have a loose bowel movement at one part of the day and then have a constipated hard movement at another portion of the day. A third feature would be gas, bloating, and general fullness in the abdomen. And the final feature that many individuals suffer with is appearance of mucus in the bowels, which is not at all concerning to physicians, but very concerning to most people when they see that in the toilet, but it is no concern at all.
Outside of a general physical examination, how do physicians determine if a patient has IBS?
The diagnosis is very much a diagnosis by history and discussion, and the characteristic tests that we might do are always going to be negative for this condition. The problem is in the muscles of your bowel, the outer lining of your bowel, if you will, and we don't have the technology to measure those muscles. And so all the tests that we have are tests for measuring the lining of your bowel and looking for evidence of inflammation, evidence of infection, or diseases within the lining of your bowel. And in irritable bowel syndrome, all those tests will be negative, and the condition lies in the muscles of your bowel, and characteristically these tests will be normal.
Dr. Gray, what types of lifestyle changes would you recommend to patients who suffer from IBS to help alleviate some of their symptoms?
Many people find that when their symptoms become more active, it's in association with stressful or nervous events. And don't forget that the bowel is connected to the brain in a very strong series of nerves, and so the bowel is very much aware of what's going on in your head and stressful events around you, and often the bowel will reflect that kind of stress. Many people deal with stress in different ways. Some people deal with stress by relaxation, watching television, reading a book. Some people find that regular exercise is very helpful for stress reduction and also for maintaining a comfortable regular bowel habit. Particularly when you tend to be constipated, a regular program of exercise, and it doesn't have to be a vigorous workout, but just simply going for a walk around the block or down the street can be very helpful to maintain a regular rhythm to your bowel, and also at the same time to help reduce stress and promote relaxation.